Doctor, we'll go on to the next question.
Hi ma'am, I'm Remya. I'm doing my BTech. I'm final year student, but I'm 22 years old now. So today youth is very much concerned about their health on skin, hair and all.
Yeah.
So I would like to know about various treatments for dandruff. Is there any relation with our daily food habits? That is, we must include more fiber content food. What all are the precautions we must take to prevent dandruff?
I think this is one of the commonest problems that almost everybody is facing.
Dandruff, it's very common. Dandruff actually involves two processes. One is there will be an increased production of the cells. There's an increased rate of production of the cells of the scalp for some reason. That's because of an inherent nature of the person. And secondly, on top of this, there is an overgrowth of a fungus called Pityrosporum ovale. And it's the combination of these two mechanisms that causes the flaking and the itching associated with dandruff. But another thing is that dandruff may not, it's usually due to something called seborrheic dermatitis. But other skin conditions can also cause dandruff, like atopic dermatitis or psoriasis. These are all things that cause a similar clinical picture to seborrheic dermatitis. Seborrheic dermatitis is the most common cause. So the first thing, you should go and see a doctor to determine what the cause of your dandruff is. And if it is seborrheic dermatitis, like I said, you should use a medicine that addresses both of the problems. That is the increased production of the cells as well as the fungus. So ideally, you should use a shampoo which contains coal tar. Coal tar is a medicine which controls the increased overproliferation of the skin cells. And or salicylic acid. This also controls the overproduction of the skin cells. And along with that, the shampoo must also include an antifungal, which may be ketoconazole, selenium sulfide, zinc pyrithione, cyclopyrox. These are all antifungals. Another thing is that usually what patients say is that, doctor, I shampoo ubechu, oru maasam ubechittum dandruff poyilla. That will never happen. Dandruff can only be controlled. It cannot be totally eradicated. There is no cure for dandruff. Just like a person needs to continue medicines for diabetes or hypertension, the shampoo for dandruff should be used at least twice a week continuously, because you can only keep it under control. That's a common mistake that youngsters make when taking treatment for dandruff.